Hello students, today we'll have a review of physiology and function of the kidneys. First part, let us look into the physiology of kidneys. The kidneys are two bean-shaped organs, each about the size of a fist. They are located just below the rib cage, one on each side of the spine, slightly towards the back of our body. They are typically 10 to 12 centimeters in length, 5 to 7 centimeters in width, and about 2 to 3 centimeters in thickness. They weigh about 150 grams in the males and about 135 grams in females. Normally located between the transverse process of T12 L3 vertebrae, with the left kidney typically somewhat more superior in position than the right one. If we look at the location of the kidneys with respect to other organs, superiorly, the suprarenal glands or the adrenal glands sit adjacent to the upper pole of each kidney. On the right side is the second part of the duodenum, the descending portion of the duodenum, that is the first part of the small intestines. On the left side, the greater curvature of the stomach can drape the middle part of the kidney. The spleen is located anterior to the upper pole of the kidney. The colon rests anteriorly to the kidneys on both the sides. Posteriorly, the diaphragm covers the upper third of each kidney. Now, if we look at the vasculature, or what is known as the blood supply to the kidneys, kidneys receive approximately 20% of the cardiac output. The blood supply to the kidney rises from the paired renal arteries. Arteries enter into the renal hilum, the passageway into the kidneys. The renal vein is situated anteriorly and the renal artery posteriorly. The lymphatic drainage parallels the venous drainage system. This is just the diagram to show you how kidney is situated or placed with respect to other organs. Diaphragm is on top, and if you see the vertebrae T12 L2 behind the kidneys, there are the adrenal glands on top of the kidneys, and then how kidneys drain into ureter, bladder, and then the urethra. If we look into the microscopic anatomy of the kidney is divided into the outer cortex and the inner medulla. The medullary tissue arranges in the form of pyramids, what are known as the renal pyramids. The renal pyramids in the medullary areas are separated by the cortical tissues called the renal columns of Burton. The filtrate gets to the collecting ducts in the medulla. Urine then collects typically into 9 to 12 minor calyces, which then converge into 3 to 4 major calyces. The major calyces then empty into the renal pelvis. The pelvis is continuous with the tube-like structure, what is known as ureter. The ureter finally traverses through an intramural tunnel into the bladder. Urine is temporarily stored in the bladder to be excreted out from the urethra. Now, if we look histologically how kidneys are, the functional renal unit is the nephron, and it is composed of the renal corpuscle, that is the glomerulus and the Bowman's capsule. The proximal convoluted tubules PCT located in the renal cortex. There is a descending loop of Henle and there is an ascending limb. The ascending limb resides in the renal medulla and it leads to the thick ascending limb. There is also thick ascending limb, the distal convoluted tubule, and there are the collecting ducts. They open into the renal papilla. Now, blood from the afferent glomerular arteriole passes through the medullary apparatus to the glomerulus. The glomerulus is a network of capillaries that filters blood across the Bowman's capsule into the proximal convoluted tubule. The glomerulus contains podocytes and a basement membrane allowing water and certain solutes to be filtered across. This filter then reaches the PCT, the proximal convoluted tubule, where it reabsorbs glucose and various electrolytes along with water as the filtrate passes through it. After being filtered at the glomerulus, the blood passes into the efferent glomerular arteriole and then descends into the renal pyramid. Next segment is the urine formation. Blood enters the glomerulus at high pressure. Much of the fluid part of the blood is filtered through the small pores of the glomerulus, leaving behind blood cells and most large molecules such as proteins. The cleared, filtered fluid enters the Bowman space and passes into the tubule leading from the Bowman capsule. In healthy adults, it is estimated that about 180 liters of fluid is filtered into the kidney tubules each day. But nearly all this fluid and the electrolytes containing in it are reabsorbed by the kidney. Only about 1.5 to 2% of the fluid is excreted as urine. Different parts of the nephron actively secrete and reabsorb different electrolytes which pull the water along with them. Other parts of the nephron vary their permeability to water, allowing more or less water to return to the circulation. Now, this function of the nephron is very important because once there is water excess or there is a dehydration, this is how the permeability will play a major role and try to restore water and electrolyte balance. In the proximal convoluted tubule, most of the sodium, water, glucose and other filtered substances are reabsorbed and again are returned to the blood. In the loop of Henle, sodium, potassium and chloride are pumped out and the fluid becomes increasingly dilute. The dilute fluid then passes through the distal convoluted tubule where most of the remaining sodium is pumped out in exchange for potassium and acid which are pumped in. Now, this again is very important to restore the electrolyte balance. Potassium is a very important electrolyte of the intracellular fluid and sodium for the extracellular fluid. The fluid from the tubules of several nephrons enter a collecting duct. In the collecting ducts, the fluid may remain dilute or water can be reabsorbed from the fluid and returned to the blood, making the urine more concentrated. This is again related to either edema or the dehydration that sets in. Urea, the end product of protein metabolism, passes freely through the glomerulus and the tubular fluid, and because it is not reabsorbed, it passes out into the urine. This is important because the end products of protein metabolism and other nitrogen containing compounds have to be excreted from the body. Other undesirable substances, including the metabolic waste products such as acids, toxins and the end products of the drugs that an individual might be taking regularly, are actively secreted into the urine by cells in the renal tubule. This is how then it shows you how different electrolytes, glucose and water are absorbed by the different parts of the nephron. In the proximal tubule, we can see that sodium, chloride, potassium, bicarbonate all are getting reabsorbed. In the descending limb of the loop of Henle, water is reabsorbed, and in the thin segment of the ascending limb, sodium chloride gets reabsorbed. The thick segment again reabsorbs the sodium chloride which is present in the outer medulla of the kidney. In the distal tubule, sodium chloride, water, bicarbonate are reabsorbed for exchange of potassium and hydrogen. As I had mentioned earlier, this is very important to maintain the balance of electrolytes. Now, if there is a need for water and sodium chloride to be reabsorbed, at the fag end they are reabsorbed in the body, but urea is not reabsorbed into the body. Now, the rate of filtration from the glomerulus to the Bowman's capsule is determined by the glomerular filtration rate, abridged as GFR, and it is a standard accepted abbreviation. The GFR helps in determining the degree of impairment in the renal function. Several kidney diseases can be identified, diagnosed and treated based on the GFR rate. The normal GFR rate should be 90 to 120 ml per minute. have looked into the kidney. Now let us look into the functions of the kidney. Kidneys play a major role in maintaining body composition, and it balances the body's fluids. It regulates the fluid volume, its osmolality, electrolyte concentration, the pH, and this is done by varying the excretion of water and ions in the urine. It removes the waste products from the body. Urea is the end product of protein metabolism. Uric acid is the end product of purine and pyrimidine metabolism, which are part of the animal foods proteins. Kidneys also remove drugs or their end metabolites, the foreign substances like toxins, from the body. It also plays a major role by secreting certain hormones or enzymes which are important. For example, it releases renin. It is important because it catalyzes the formation of angiotensin, which is an important component for regulating both the blood pressure as well as the salt balance. The proximal tubule cells produce an active form of vitamin D, that is the 1,25-dihydroxycholecalciferol. Now this is very important because it promotes strong, healthy bones by regulating both the body calcium and phosphorus. Now that is why it becomes imperative that in kidney diseases, calcium supplements have to be given to the patient. It also plays a major role by controlling the production of red blood cells, the RBCs. Erythropoietin stimulates the maturation of RBCs in the bone marrow. Same logic, if there is a patient with kidney disease, again he can have anemia which needs to be treated because the erythropoietin secretion and function can be altered. There are certain warning signs of kidney disease. Very often it has been observed that kidney disease may not become very obvious or precipitate till a large segment of the kidney is damaged. That is why there are certain signs which an individual should be wary of. Kidney disease usually affects both the kidneys. If the filtration ability is affected, both the waste and the excess fluids may build up inside the body. Many forms of kidney disease do not produce symptoms till it is very late in the course of the disease. So here are some of the signs and symptoms that an individual should be careful about. Elevated blood pressure. Of course, elevated blood pressure can be associated with cardiac disorders also, but it is also a major sign when kidney disorders are concerned. There can be presence of blood and or protein in the urine. There is frequent urination, particularly in the night, and the urination can be difficult or painful too. There is water retention, and that is why there can be puffiness around the eyes, swelling of hands and feet, what is typically seen as edema. If the blood test is done, definitely it might be observed that the creatinine and the blood urea nitrogen BUN can be seen, and if they are beyond the normal range, it can be assumed that it is related to some kidney disease. And most importantly, the GFR. If it is less than 60, it means there could be a kidney disease. There are several tests which measure kidney function, probable damage, and even the abnormalities that are associated with kidneys. It is important to remember that healthy kidneys remove waste and excess fluid from the blood. Blood and urine tests show how well the kidneys are doing this job of removing waste and the excess fluid from the body. Urine tests tell us how quickly the body wastes are being removed and whether the kidneys are leaking abnormal amounts of proteins, because this is not a part of the normal constituent of the urine. Blood test. The first one, serum creatinine. Creatinine is a waste product that comes from the normal wear and tear of the muscles of the body. Creatinine levels in the blood vary depending upon the age, race and body size. A creatinine level greater than 1.2 for women and 1.4 for men could be an early sign that the kidneys are not functioning properly. The level of creatinine in the blood rises when the kidney disease progresses. Second is the GFR, the glomerular filtration rate. This test is a measure of how well the kidneys are removing waste and excess fluid from the blood. It is generally calculated based on the serum creatinine level using the age, weight, gender and body size. The creatinine clearance test is a reflection of the glomerular filtration rate. It varies according to age and generally it decreases as the age advances. The normal value for GFR though is 120 ml per minute. Even 90 and above can be considered normal. But a GFR below 60 is a sign that the kidneys may not be working properly. And if it is below 15, it indicates that the treatment for kidney failure such as dialysis or a kidney transplant may be needed for the individual. 1. The blood urea nitrogen. The urea nitrogen comes from the breakdown of protein in the foods that we eat. We eat different types of food which can be rich in proteins. Pulses, legumes, animal foods like egg, poultry, meat, they all are rich in proteins. And then the urea nitrogen is an indicator how well this is removed from the body. A normal BUN level is between 7 and 20. But if the kidney function decreases, the BUN level rises. Then there are even urine tests which tell us whether the kidneys are functioning normally or not. So the urine analysis, the basic urine analysis checks for the presence of abnormalities such as excess amount of protein, blood, pus, bacteria and sugar. Now all these are not the normal constituents of the urine. Protein is not present in urine as a normal constituent, nor is sugar. But if sugar is present, it is definitely an indicator that probably the patient is heading towards diabetes and he has to be treated accordingly. Similarly, presence of protein or blood implies that the filtration function of the kidneys is getting altered. Now this urine test then helps to detect kidney and urinary tract disorders including CKD, the chronic kidney disease, diabetes, particularly when sugar is shown in urine, bladder infections and kidney stones. Creatinine clearance. A creatinine clearance test compares the creatinine in a 24-hour urine sample and it shows parallelly the creatinine levels in the blood, and this tells how efficiently the blood is able to filter the creatinine. Apart from that, even imaging tests are very common to see whether the kidneys are functioning normally or not. Ultrasound or the sonography. This test uses sound waves to get a picture of the kidney. It may be used to look for abnormalities in size or even the position of the kidneys, or sometimes to see if there is any obstruction such as stones or tumors. Another one is the CT scan. This imaging technique uses contrast dye to picture the kidneys. It may also be used to look for structural abnormalities and the presence of obstructions. Again, obstructions could be predominantly due to stones. Then kidney biopsy. Kidney biopsy again is very important, particularly when there are advanced diseases of the kidney. It is done generally when to identify a specific disease process and determine whether it will respond to a treatment. It also helps to evaluate the amount of damage that has occurred to the kidney and to find out why a kidney transplant may not be doing well. Now this is particularly important in kidney transplant cases. A kidney biopsy is generally performed by using a very thin needle with a sharp cutting edge to slice a small piece of kidney tissue for examining under the microscope, and the microscopic examination will clearly give how far the kidney pathology is normal or abnormal. So, before we close, we have certain points to remember. Kidneys are the excretory organs of the body, but they also perform several other functions like maintaining water and electrolyte balance. They secrete hormones which help in calcium metabolism, and they also help in the maturation of RBCs. Kidney function tests help in detecting any underlying disease so that it's easy for the medical doctor to treat the patient accordingly. Tests can also help to diagnose diseases or if there is any disease of the kidney itself. Thank you.